Anxious perspiration drops beat up on the brow of a 14-year-old girl as she leans over the bathroom sink, staring at the positive results of her at-home pregnancy test. Fear sweeps through her body, and her mind races with thoughts of what she's going to do about this unplanned pregnancy. This girl was my mother. My mother considered aborting me, even went to the abortion clinic. I am thankful that she chose life for me, and am passionate about encouraging others to do the same. I have worked in the crisis pregnancy help centers and have been trained to counsel women who are considering abortion or suffering from a post-traumatic abortion disorder. Abortion is claiming a countless number of lives across the globe. I believe this monstrosity often occurs because people are simply uninformed. When people are empowered with information concerning abortion, they can use it to make life-saving decisions and take a stand against abortion. I will validate my concerns about abortion by defining abortion and its existence, go over some early fetal development facts, give a clear explanation of abortion procedures and their risks, and to scripturally show how abortion grieves the heart of God. What is abortion? Why does it exist? According to the dictionary, abortion is the removal of an embryo or fetus from the uterus to end a pregnancy. Essentially, abortion is the taking of a human life. You will understand this better as we go over fetal development and see when life begins. Now, by reason of this definition, abortion exists to end an unwanted pregnancy. People come up with all different reasons for abortion, justifying the existence of abortion. Some of them selfish, most of them selfish, like not having enough time or money for a child, simply just not wanting a child, even justifying abortion because of some type of abnormality, which is just a form of discrimination against disabled people. Wouldn't you agree? One of the leading providers of abortions in the U.S. is Planned Parenthood. They claim that by the age of 45, 1 in 3 women will have had at least one abortion. So you see, abortion is more common than you may have realized. And you would be surprised how many people or families you know that have been affected by abortion. To better understand the state of a preborn human, here are a few simple fetal development facts. At the time of conception, all the genetic features of a person are set. Gender, hair color, eye color, whether will be short or tall, and so on. Although smaller than a grain of sugar at this time, all this new life needs is oxygen, nutrients, and a little time in the mother's womb. 3 weeks after conception, the tiny heart begins to beat. And by now, the brain, the spinal cord, and the nervous system foundations have been laid. Here in a minute, I will explain to you how abortions are performed. It's important to note that the child's nervous system is in plane and that the brain is functioning. During the next 8 months in the womb, the child is rapidly growing in strength and can even recognize the mother's voice by month 7. For the sake of time, I've only touched on a few fetal development facts that I believe to be the most important. There are several forms of abortion. Although this information is graphic in nature, I make no apologies for trying to make abortion sound nicer than what it is. There are 2 types of pills for abortion, the morning after pill and a pill called RU486. These pills are taken orally and cause a baby to keep from implanting in the uterus where it would receive the oxygen and the nutrients it needs to survive. The child suffocates or malnourishes and is aborted. The second method is the vacuum aspiration method. It's done in the first trimester. Now this sounds exactly like what it says. The baby is sucked from the womb with a hose, its limbs being torn into pieces. The next is like it, the dilation and suction curettage, or more known as the D&C. It is like the vacuum aspiration, but is done after 14 weeks. The child is scraped from the womb, before being sucked out by a large loop-shaped metal knife. The fourth method is a saline injection. Saline is injected into the uterus or directly into the child's heart so that it's poisoned and delivered as a stillborn. The risk factors involved in abortions are both physical and mental. According to the American Pregnancy Association, physical risks include nausea, bleeding, abdominal pain, vomiting, diarrhea, scarring, damage to the uterus or surrounding organs, infection, and possible infertility. Women who have abortions also run a high risk for emotional or mental issues. These include, but are not limited to, regret, anger, guilt, shame, feelings of loneliness, depression, insomnia, nightmares, suicidal thoughts and tendencies, eating disorders, drug and alcohol abuse, or anxiety. Post-abortion syndrome is a very real thing, and it affects women for years after their abortion. In 1973, the U.S. Supreme Court labeled the preborn child as non-person. A person is now redefined as somebody who is wanted, useful, or not too badly damaged. But what does God say about a person? God says that we are fearfully and wonderfully made, that He knits us together in the womb, that before we were even formed, He knows us and has a plan for us. In this presentation, you have been informed of what abortion is, some reasons women choose abortion, a few fetal development facts, how abortions are performed, and what God says about a person. Now, what to do with this information? Why should it matter to you? As I stated earlier, information is empowering. Use this information to teach your children to value human life, to speak up against abortion when the opportunity arises, and stand against abortion when voting in any political elections. Some of you might think that even though you are opposed to abortion, you can't tell others what to do. This is a lie from the devil. Silence only adds to the problem. Voices must be raised on behalf of the preborn children. Now, if I didn't present enough scripture to convince you that God recognizes life in the womb as sacred, the 21st chapter of Exodus says that if somebody causes a pregnant woman to lose her child, they should lose their life. A life for a life. Now, I know this is Old Testament law, and hear me, I am not debating the law, but simply showing that God recognizes life in the womb to be as important and as entitled as anyone else. I asked just a minute ago, why should this matter to you? If God cares about the lives of the preborn, and He does, so should we. Thank you.